UNAIDS says most countries around the globe are off target in both HIV treatment and prevention among children. In South Africa, over 90,000 children living with the virus have fallen through the cracks and are not on treatment, as Nobuhle Modise reports.
Today is day 3 of the 11th SA AIDS conference, and today's session around the Global Alliance to End AIDS in Children by 2030 was launched as well. I am here with Ms. Christine Muhigana, who is the UNICEF representative in South Africa, and she spoke on the progress that's been made and what has been done so far, and I want to bring her into the conversation just to speak to us about the presentation that she gave earlier on. Thank you very much, Ms. Muhigana. Just speak to us. I mean, you spoke about widening gaps between adults and children. Just expand on this for us.
So we're here today because we want to continue to raise awareness about the fact that in spite of the progress that's being made here in South Africa and globally to put people on treatment, so to test them, we want to have 95% of people tested. We want those who are tested and are positive to be on treatment so that their viral load is suppressed, so that they do not transmit the virus anymore. And we are unfortunately in a situation where progress is made for adults, but the progress is lagging behind for children. So less children are tested. Those who are tested, we know of 90,000 or more of them who have been tested positive, but we do not have them on treatment, and therefore their viral load is not suppressed. We need to have in place programs that allow us to keep track of the children who are tested positive. They need to be on treatment, and we need to also make sure that the young women or the women who are positive do not transmit the virus to their children, so that we end the vertical transmission of HIV to children. No child today should become positive of HIV, and if he or she is positive, they have to be on treatment. We need to be able to know where they are and make sure that they are on treatment and can grow and progress positively in their communities, in their families.
All right. And then lastly, Ms. Muhigana, just speak to us briefly about that draft of the schematic plan of the Global Alliance plan. Just speak to us on that draft.
So the plan is supposed to be a multi-sectoral one. We have here in South Africa a process that's coordinated by the South African National AIDS Council, SANAC, and we bring together partners from the Department of Education, Department of Social Development, Department of Health. So there's various systems and platforms that need to come together so that we reach those children, those adolescents who we want to protect from HIV infection, and when they are affected or infected by HIV, we want to make sure that they have the treatment, they have the support system that they need, so that we progress in a way that the protection is reaching both adults and children. And we are today and there in a situation where we really need to make sure that we know where the children who are infected by HIV/AIDS today are, so that they get the treatment, that they get the nurture, the care that they need to progress in their lives.